Hello, I'm Dr. Rosie. I'm a perinatal clinical psychologist and founder of the Birth Healing Collective. And today we're going to be talking about navigating pregnancy and birth after a previous experience of your baby being in the NICU, right? The neonatal intensive care unit, or whatever that's called where you are. Because this is something that comes up a lot in my work with parents who are preparing to give birth again after a previously difficult or challenging or traumatic experience. And having a preterm birth or any experience where your baby needed additional medical support can be a traumatic experience for many families. And understandably then, this is something that impacts future pregnancies. So today we're going to think about some of the common fears that come up, and I'm going to talk you through my ideas on what can help you cope. So firstly, how does having an experience of NICU tend to impact families? Well, having your baby require intensive medical care is scary at any point. And immediately after birth, when you yourself are recovering, adjusting to the fact that you've just had a baby, whether your baby is in the NICU for an acute short time or a lengthier stay, it can be a really deeply challenging start to parenthood. So many parents will describe their NICU experience as scary, overwhelming, intimidating, and about a third of all parents, about 40%, will describe it as traumatic. And we know that this has a big impact on mental health. So there have been some surveys done in the UK which found that about 80% of NICU parents will say that their mental health declined after having that experience with their baby in the NICU. And I think it's around 15% of all NICU parents will actually develop a post-traumatic stress disorder, PTSD, to their experience in the NICU based on what happened with their baby. So these are not small experiences, right? They might be common, but they can be really, really scary. So I really think that we need to do better at recognizing quite how traumatic these experiences are. And the fact that even if many months or even years have passed since your baby came home and you've all been doing pretty well since then, the feelings and fears connected to that experience in the NICU can really come back up again as you prepare to give birth again and welcome another baby into your family. Pregnancy and birth are things that we don't fully control, and that can be really, really mentally challenging. And I think we just have to acknowledge that when it comes to preparing to have another baby. I want you to know, first and foremost, that your feelings about this make sense. It is a huge thing to be doing. It is scary. And I think that there are a few things in life where we make a conscious choice that actively takes us back towards something that has previously been really challenging and difficult for us, our partner, and our baby. So what will help you is going to be really individual to you. But I will share my thoughts here on what can help and what I hear helping and see helping the families that I work with. So what can you do to help you cope when it comes to pregnancy after NICU? Well, the first thing I would say is to spend some time figuring out what you might need to feel as safe as possible going into another birth and having another baby. And this is so individual, as every single parent that I work with needs something slightly different when it comes to feeling psychologically safe enough to do pregnancy and birth again. So I think it can be helpful here to try to shut out the noise of everybody else's ideas and experiences of birth and just think about your own, and take the time to go back and reflect on your previous experience of birth and pregnancy and the NICU. Because, you can do this at home with your partner and kind of write it all down, work it through together. But you may also find it helpful to work with a professional to kind of debrief and make sense of what happened at the birth. And this can be particularly helpful if there were certain factors to do with health or factors to do with the birth that may have affected your baby's need for specialist care. And if there are specific medical situations that unfolded for you, it's going to be really important to think about whether or not you might need specific care to manage those risks this time around. And this is where I think it can be very helpful to talk to your provider about maybe seeing a specialist, like a maternal fetal medical specialist, somebody who's trained to care for women who are at risk of having high-risk pregnancies or pregnancy complications. Because I think sometimes you can just find that it helps you feel safer knowing that these risks are being thought about and potentially being managed differently this time around. So that might look like organising extra appointments or scans or tests. It might look like certain medication being prescribed to you, certain treatments. And it might look like having a birth plan that is designed to reduce the risk of certain complications from happening. So that all of that can come together to help us feel slightly safer when it comes to navigating another pregnancy. The second thing I would say is that it's so important to find your voice. And what I mean by that is to get enough information from your care provider to actually feel like you understand the risks as they apply to you and can feel involved in the decisions, and really ideally be the person making the decisions about managing those risks. So yes, of course, we want to benefit from all of the information and knowledge and experience that our professionals can bring to the table. But we know when it comes to birth after birth trauma that being involved in the decision making often helps parents feel much more in control during pregnancy. So this is why I always encourage parents to build a strong voice during pregnancy, to build your confidence up, to ask questions and really get the information from your care team. There is no question that is too small or wrong or too silly. You deserve to know the information and anything that your specialist can tell you about why your last baby was born early or unwell, what the risks are in this pregnancy in their opinion to you, and what extra things they can be put in place for you. So by finding your voice, you can ask directly about anything that's worrying you during your appointments, and then actually benefit from all of that knowledge and experience that they have as you make the decisions about your next pregnancy and birth. Now, related to that, another thing that I think can be hugely beneficial is writing what I call a trauma protective birth plan. And this is a birth plan that is so much more than a piece of paper, right? A trauma protective birth plan has an extra focus, which is all about communicating what happened to you last time, how that affected you, and your concerns, as well as having an extra section in it about managing those. So I have a class on how you can write your own trauma-informed, trauma-protective birth plan. And if you do that class, I'll teach you how your birth plan can be such a valuable tool. It can really highlight this key information for anyone who ends up coming into your birth and into your pregnancy at any stage. And that just means that you've got a much, much higher likelihood of better care, better support, and better communication. So it's kind of like you take care of communicating these things to your care team so that they can be aware of them as you go into pregnancy and birth. And I think it's one of the ways that we can pull people into providing better, proper trauma-informed care. Now, because birth is so uncertain, when it comes to writing a birth plan or really just sort of thinking through what you want for your birth, I think the difficult thing about birth is that there will always be factors that we don't control. So I think in some ways this is about doing all the preparation that you can and then learning how to cope with the uncertainty of birth that will still remain. And I often talk about tolerating this because I do not think that you have to love it. Maybe you're never going to love it, but you can learn to tolerate it. And there are things that can help us cope with it. So, one thing that I always do come back to is that we know that what helps us tolerate what we don't control is being able to focus and keep coming back to the pieces that we do control. And by focusing on those pieces when it comes to birth, we can actually sort of strengthen up our sense of being in control during pregnancy and birth itself. And that helps us manage the bits that we don't control. The place that I always come back to, if we're thinking about what you can control when it comes to pregnancy and birth, is that you can control the decisions that you make. And sometimes This comes down to being able to navigate through the system with a strong voice that communicates your needs and doesn't let your birth be sort of swept along by other people's decisions or routine procedures or hospital policy, but really feeling equipped and empowered to make the decisions that are right for you. The next thing that I'm going to touch on today is coping with anxiety. Just getting as much support as possible in your corner to help you manage the anxiety that will likely bubble up and be around during this pregnancy. I always bring this back to figuring out what is right for you and what is going to work for you. So this might be therapy, and I would recommend going to see a perinatally trained clinician who understands about NICU and birth and motherhood. But if you're not going to go to therapy, then it might be that what works for you is extra support from your friends and family, or regular exercise, yoga, meditation, massages. Personally, I know from the clients that I work with, the families that I support, how much it helps to have tools that you can easily reach for that help you respond to the what if thoughts that keep coming, the waves of anxiety that might come up in your body. So this is something that I actually teach a lot inside my Better Birth program, knowing how to regulate your nervous system, because it's so powerful to be able to do that, both for pregnancy and birth. So, getting good at managing anxiety, getting equipped to cope with anxiety, that's going to be a wonderful part of preparing to have another baby. Couple more things I've got on my mind today. Planning for postpartum. One thing about having been through NICU before is that now you have a much more detailed understanding of what it involves, and you can actually use that to bring into your planning of what you might need for yourself if your next baby might need some of that additional medical care. So this can be a really practical plan about like who's going to care for your older children, meals, laundry, involving some extra breastfeeding support beforehand so that you're set up and already linked in. Or it might also be thinking about your mental health. What support might you need in place? What about your partner? What support might they need? We can really think ahead about that postpartum now that you have a bit more knowledge of what that can be like, and use that to put some concrete things in place. And I find that can actually help people feel a bit more like, okay, it's a bit more in control. If something was to happen, I'm ready. And that helps settle us a bit. Lastly, I just want to say that I think it can be important to remember that every pregnancy is different, and you are too. So as hard as it is, and you may not believe this fully at every day, but it can help to remind yourself every day that no two pregnancies are the same, ever. And this is a new pregnancy with new possibilities and new opportunities. And the other thing is that you are different too now. You're already a mum, and you bring to this experience everything you've learned from everything you've been through previously to help you cope. So I think I want you to just try to reflect on your own wisdom and knowledge, growth and strength, and try to make room for some hope and possibility alongside those fears. If you're looking for more support as you prepare to give birth again, then do come and check out the resources and programs that we have on offer at the Birth Healing Collective.